A pleasant day to each and everyone. I hope everyone is doing well, and our topic for today will all about the cranial nerves. As discussed in the previous lessons, the cranial nerves are part of your peripheral nervous system, and we have 12 pairs of cranial nerves. You can see here in this table that cranial nerves are numbered from 1 to 12, and they have their respective names. Cranial nerve number 1 is your olfactory nerve. Number 2 is your optic nerve. Cranial nerve number 3 is your oculomotor nerve. 4 would be your trochlear nerve. 5 would be your trigeminal nerve. 6 would be your abducens. 7, facial. 8 would be your vestibulocochlear nerve. 9, glossopharyngeal nerve. 10, vagus nerve. 11, accessory nerve. And 12, hypoglossal nerve. And we have here a mnemonic that would help you be able to memorize or familiarize yourself with the different names of the cranial nerves from 1 to 12. So the mnemonic goes O to touch and feel very green vegetables. Okay, that's O to touch and feel very green vegetables. Of course, you could always make your own mnemonic that would help you in memorizing things, okay, or especially different structures or different nerves for this matter, okay? So let's proceed. So for the function, we have to identify if the cranial nerve has a function as a sensory nerve or as a motor nerve, or if this cranial nerve has both functions as sensory and motor nerve. Okay, so it's either the nerve is a sensory nerve, a motor nerve, or having both sensory and motor functions. And there's also a mnemonic that would help us be able to somehow memorize the function of each cranial nerve. So the mnemonic goes, some say marry money, but my brother says big brains matter more. Okay, some say marry money, but my brother says big brains matter more. If you would search the net for the different mnemonics, you would be able to find different mnemonics, but I would suggest that you memorize the mnemonic that would really have an impact in memorizing them, and somehow you create a story that would be more creative, and you could be more imaginative about it so that you would be able to remember them. So your olfactory nerve is purely sensory, optic nerve also sensory, oculomotor, your trochlear and your abducens are purely motor nerves. Your trigeminal nerve has both sensory and motor functions. Your vestibulocochlear, purely sensory. Facial nerve, both also sensory and motor. Your glossopharyngeal nerve and your vagus nerve have both sensory and motor functions. Your accessory and your hypoglossal nerve, 11 and 12, are both purely motor nerves. Okay, so we'll discuss them one by one. Okay, so what cranial nerve is primarily associated with the following features? So we have here someone smelling a flower, then the yellow structure here is the nerve that is associated with these pictures, and then someone is checking, assessing the nose. So the answer is your olfactory nerve or your cranial nerve number 1. It is a special sensory nerve. So the principal function, why is it a sensory nerve, is olfaction or the sense of smell, or simply put, smelling. No? So how do we test if the olfactory nerve is functioning well? Okay, we do a sniff test. So sniff test is letting the patient identify the scent one nostril at a time. So you prepare different containers that are primarily not transparent, or you could cover the container. So as when, if the patient is able to see uh, the the content inside, he or she will not be able to identify that's that component, whether it's a food, no, or a part of a thing, using the eyes. Okay, so we're testing the sense of smell here. So you could use mild soap or coffee, or even scents of the fruits. Okay, lemon, perhaps banana or apple. Strong. Do not use scents that are volatile. Okay, and that quickly evaporates. Do not use perfume or even alcohol. Okay. The medical term that we use when someone has a loss of the sense of smell is anosmia. So this is somehow used in news, or maybe uh, included in the checklist if the patient has COVID or not. Okay, so olfactory nerve, cranial nerve number one, sense of smell, special sensory. So how about in this picture? So we have different letters here in the chart and different sizes. And then you could see here in the structure colored in yellow, there's a part that crosses one another, and we call that your optic chiasm. Okay, so this is your optic nerve, cranial nerve number two. It is also a special sensory nerve for the function of sight or vision. So how do we test for the visual acuity? How clear are our eyes? Uh, how our eyes sees things clearly and be able to identify uh, the letters with the different sizes. So we use the Snellen chart. Okay, we usually use the Snellen chart. We position the patient 20 feet away from the chart, and then we start from the biggest letter down to the smallest number that the patient would be able to identify correctly. And we assess one eye at a time. So we cover one eye, and then we proceed with letting the patient identify the different letters. And then the normal VA, or the visual acuity, is 20 by 20. Okay, 20 by 20. A visual acuity with 20 over 200 is considered already legally blind. Okay, 20 over 200. So your optic nerve is a special sensory nerve with the principal function, vision. How about in this picture, what cranial nerves are primarily associated with the movement of the eyes, with using the different extraocular muscles? You've learned in the muscular system that the eyes have different extraocular muscles, and we have four recti muscles and two oblique muscles. So you have here your superior, inferior, medial, and lateral recti muscles. And then you have your superior and inferior oblique muscles. And these muscles, extraocular muscles, are innervated by three different cranial nerves. Okay. So these three cranial nerves are your cranial nerves 3, 4, and 6. 3 would be your oculomotor, 4, trochlear, and 6 would be your abducent nerve or your abducens. So these three are purely motor, okay, or somatic. So they innervate the movement of the eyeballs through these extraocular muscles. However, your cranial nerve number 3 also has a component that innervates the movement of the upper eyelid. And additionally, your cranial nerve number 3 also is associated with the constriction of your pupil, especially when there is a light stimulus, light, ilaw, and also has an autonomic motor component for accommodation. This is for the adjustment of the lens for near vision. So the lens flatten when we look afar, and then the lens become thicker when we look at a near object. And how do we test for the 3 extraocular muscle nerves? We check for ptosis because cranial nerve number 3 also has a component for the movement of the upper eyelid. Ptosis is the drooping of the eyelid. Okay, nagdo-droop, it lowers down because there's no innervation. Okay, we also check for the size, shape, and the symmetry of the pupils. Why? Because cranial nerve number 3 has a component also for the constriction of the pupils. Once we introduce light, a light source from the pen light, perhaps the pupils usually should normally react briskly or fast, and then it constricts. The size becomes smaller. Okay, the size would be round, the shape, the size should be equal around 3 to 5 millimeters, and then shape would be round or oval, round, okay, round, and then it should be equal with the left and right pupil should be equal with one another. Okay, so usually the physical examination that's normal would be you take note of the size, maybe 3 millimeters, and pupils equally round and briskly reactive to light and accommodation. And then we check for the ocular movement exam. Okay, check for lagging or nystagmus. So you let the patient follow a particular object. You could use your finger, follow uh, my finger using your eyes. Okay, and then you draw a letter H slowly. Okay, you draw a letter H slowly so that you would be able to assess the different directions of the uh, different extraocular muscles with the letter H. Okay, so slowly so that you would be able to see if the pupils or the eyes have lagging. Okay, so one of the lagging, mahina yung isa, or there would be nystagmus. Okay, so I want you to remember here in color blue, SO4, LR6, and the rest 3. Okay, your superior oblique muscle is innervated by your cranial nerve number 4, trochlear, and then your lateral rectus that abducts your eye, okay, would be innervated by your cranial nerve number 6, abducens nerve or abducent nerve, and then the rest of the uh, extraocular muscles are innervated by your oculomotor nerve. So that would be your superior rectus, inferior rectus, medial rectus, and your inferior oblique muscles. Okay, let's proceed. So I included this picture, this slide, so that you would just be able to correlate what we've learned and be able to apply it how the eyes would look like when someone has a palsy or an abnormality with the cranial nerves 3, 4, and 6. Okay, so how about for this picture? What cranial nerve are we dealing with? Okay, so here you can see the face has three divisions. Okay, primarily innervated by three branches, and then a kid biting or maybe chewing in a wild carrot. Okay, so we're dealing with the trigeminal nerve, or cranial nerve number 5. Trigeminal because it has three main branches. Okay, your trigeminal nerve is having both sensory and motor functions. Sensory, it has a function for touch, pain, and thermal sensations from the scalp, face, and oral cavity, including the teeth and anterior two-thirds of the tongue. Sense, okay? Touch, pain, thermal sensations. It has also a motor function because it has both functions. Motor function, branchial, okay, for chewing and controls middle ear muscle. So we have muscles in the middle ear that are innervated by your trigeminal nerve and chewing. So the not all muscles of the face is innervated by facial nerve because your third branch of the trigeminal nerve, which is your mandibular nerve, innervates the muscles for mastication or chewing. That's the reason why your trigeminal nerve is a mixed nerve or has both functions, sensory and motor nerve. And how do we test for the trigeminal nerve? Here in this picture, you have uh, three divisions, okay? Because this entails the three areas where your three branches of the trigeminal nerve innervate. So you have your three main branches, V1, V2, and V3. Okay, V1 is your ophthalmic branch, V2 would be your maxillary branch, and then your V3 is your mandibular branch. Okay, so your ophthalmic branch here is the area in color yellow. Maxillary would be the orange, and the mandibular would be the lower part. Okay, so how do we test? We let the patient close the eyes, and then since uh, the face is innervated with the light touch, okay, we ask the patient to identify where did we apply the stimulus, the light touch. It could be a sharp or a dull object. Okay, for example, my finger would be the stimulus. We ask the patient to close his eyes, and we test for the ophthalmic area, the maxillary area, and then the mandibular area. Okay, so for example, we apply the stimulus here. Okay, then the patient point with eyes closed, uh, dull sensation here, here. I feel it here, 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 here. Okay, so uh, that's how we test for the sense of touch with the different areas of the face of the three different branches of your trigeminal nerve. And then, since your V3 of your mandibular branch also innervates the muscles for mastication, we test for the range of motion or your ROM of your jaw. So we could ask the patient to uh, move your jaw from side to side, retract the jaw, and then retract the jaw. Okay, movement of the jaw. And then corneal reflex is included also in your trigeminal nerve. Okay, corneal reflex is when we get a piece of cotton and then you ask the patient to look opposite, to not look at you. Okay, and then you try to get the cotton and then try to whisk it at the side of the eye, okay, without the patient looking at it. And then the normal response would be the patient would blink or close his or her eye. Okay, that is being simulated. Okay, because your trigeminal nerve here uh, would act as the afferent nerve. It would be the one sensing the touch of the cotton to the eye. Okay, afferent. Then we'll learn later that the efferent nerve would be your facial nerve. Okay, so corneal reflex, afferent use of the trigeminal nerve. Okay, let's proceed. So, what do you think would be the cranial nerve that is primarily associated with the different facial expressions, and then the taste anterior two-thirds of your tongue or licking sweet ice cream? Okay, different expressions here. So, we're talking about the seventh cranial nerve, your facial nerve. It still has both sensory and motor functions. Sensory taste from the anterior two-thirds of the tongue. Remember, anterior two-thirds. And then there would be touch, pain, and thermal sensations from skin in external ear canal. Okay, facial nerve. And then branchial motor function, control of muscles of facial expression and the middle ear muscle also. And then motor, autonomic function, secretion of tears and saliva. Okay, so do we test? We test for or assess and observe the facial expression of the patient. So we ask the patient to smile, frown, lift the eyebrows, close eyes tightly against resistance, puff out the cheeks, and smile with teeth out. Okay, then so we assess the facial expression. Is it equal or symmetric left and right? Okay. We assess for the nasolabial fold here. It should be equal. Okay, because if there is paralysis of one side, for example, in this side, so this one will move. When we ask the patient to smile, there would be the nasolabial fold. If this won't move, there would be flattening of the nasolabial fold. It won't be uh, as prominent as this one. Okay, so it should be symmetric left and right. Okay, and then we could ask also the patient to indicate the taste by pointing to which side was the taste introduced. So we test also the left and the right sides of the anterior two-thirds of the tongue. Okay, so we could give a uh, different flavors for the mouth. So we could use uh, sour, sweet, salty, and even bitter taste components. So here you could see the corneal reflex again, because again, as what I've mentioned, it's the efferent part of the facial nerve that would respond with the blinking of the facial nerve, blinking of the eye with the corneal reflex using the cotton wisp. Okay, so let's proceed. So you see here the ears, primarily the hearing, and we have the Rene's and Weber's test using the tuning fork if there is an abnormal hearing acuity. And you see here in this part, okay, the vestibulocochlear nerve. So it's the cranial nerve number 8. You could see here in this picture here, the vestibulocochlear nerve has two main branches, the vestibular branch and the cochlear branch. So vestibular branch would is primarily concerned with the equilibrium or the balance function, maintaining the balance in the body. Even though we close our eyes, we know how our body or how our head is positioned. We know if we are upside down, if we're tilted towards the left or towards the right, if we're closing our eyes because of the vestibular branch of the vestibulocochlear nerve. And the cochlear branch is responsible for hearing, okay? The sense of hearing. So this is your vestibulocochlear nerve. It's a special sensory nerve because the principal function is hearing and equilibrium. Okay, so we test the hearing, and if the hearing is abnormal, we proceed with the Weber's test. We use the tuning fork in Weber. So you could see here that in Weber, we place the tuning fork at the center. We test for lateralization. That means if there is a side, whether if it's at the left or right ear, hearing more or hearing louder. Okay, so there could be an abnormality. Okay, Weber's test. And in Rene, we compare uh, the air conduction and bone conduction. The normal is air conduction would be longer or greater than your bone conduction. Air conduction greater than your bone conduction. That means that even after, even because the end of the tuning fork, if you could see here in this picture in the bone, okay, we place it at your mastoid, okay, and then uh, if we flick the tuning fork, we place the end of the tuning fork at the mastoid, and then once the sound disappears, okay, or the vibration disappears, we place the tuning fork at the side, okay, and then because it's now air, we could still hear as compared to the bone conduction. So it's quite complicated, but I just want to emphasize that air conduction is greater or longer than for bone conduction. Okay, so how about this one? What cranial nerves are primarily associated with the following features? Okay, it's swallowing, and then there's gag reflex. Gag reflex is a reflex wherein when there's a stimulus behind, for example, here in this picture, the tongue depressor, okay, the tongue depressor touches your uvula, the posterior back of the the roof of your oral cavity or the back of your tongue or even your back of your throat, okay, that stimulates contraction of your throat, okay. This is a protective mechanism so that we won't be able to swallow harmful objects, harmful swallow harmful substances or liquids, and then we gag. Okay, so it's like swallowing because there's contraction of the throat. Okay, and then swallowing is also associated with these cranial nerves. So these cranial nerves are your cranial nerves 9 and 10. So your 9 is your glossopharyngeal nerve. It has both sensory and motor functions. Sensory taste from the posterior 1/3 of the tongue. Remember, the anterior 2/3 is for the taste is innervated by your facial nerve. Okay. The posterior 1/3 is innervated by your, for the taste. Posterior 1/3 is your glossopharyngeal nerve. So proprioception in some swallowing muscles, it uh, also monitors blood pressure and oxygen and carbon dioxide levels in blood. So there is also touch, pain, and thermal sensations from skin of external ear and upper pharynx. That's for the sensory function of your cranial nerve number 9, and it has also motor functions, assist in swallowing, and it also for secretion of saliva. And then your 10, cranial nerve number 10, or your vagus nerve also has both functions, sensory and motor. Sensory taste from epiglottis, proprioception from throat and voice box muscles, monitors also blood pressure and oxygen and carbon dioxide levels in blood, and then touch pain and thermal sensation from skin of external ear and sensations from thoracic and abdominal organs. So it also assists with swallowing. So if you notice, both 9 and 10 uh, have motor functions for that assist with swallowing. So we usually ask if the patient does not have any problem with swallowing, or we let the patient swallow in front of us water, for example, and then vocalization and coughing for the vagus nerve motor function, and for the autonomic motility and secretion of gastrointestinal organs, constriction of respiratory passageways, and then it also has an effect that decreases heart rate. Okay, when the vagus nerve is stimulated, we usually expect that there is a decrease in heart rate that sometimes could be harmful and really could also be fatal in some cases, especially when the patient already has a problem with the heart. Okay, so proceeding. So you can see here that the man is doing this one, shrugging of the shoulders, even when weights are present. Okay, so we're talking about the accessory nerve, or your spinal accessory nerve. It is a purely motor nerve. It has a principal function of movement of head and pectoral girdle. Okay, movement of head and pectoral girdle, primarily here in the head. So we ask the patient to shrug shoulders against resistance. So we could apply resistance here, and we ask the patient to shrug shoulders against the resistance. Okay, so we could also ask the patient to move the neck laterally, look at the left to the right. Okay, so this is your accessory nerve. And then the movement of the tongue, and then they point the tongue out. Okay, so normally the tongue should be at the midline. So your hypoglossal nerve is a purely motor nerve, functions for speech, manipulation of food using the tongue, and also for swallowing. So we ask the patient to stick the tongue out. It should be at the center. So normally tongue is at the midline. And then once if the ask the patient to stick the tongue out and it points either left or to the right, it points to the side where the abnormality or the lesion of the nerve is present. For example, my tongue points towards this side. So the abnormality is at this side. The lesion of the cranial nerve number 12 is at this side. This is my right side. Okay, this is my left. Right side is the problem because again, your cranial nerves are in pairs, left and right. Okay, so if there's a problem with my right hypoglossal nerve, a lesion, for example, the tongue would point towards the right side. Why? Because the muscles of the tongue are when we stick the tongue out, are oriented towards the midline. Okay, the direction is towards at the midline. This is my tongue, point towards at the midline. If this side is weak, okay, so because there is no innervation, or there is weak innervation, weak this side, this would push the tongue towards this side. Okay, because the muscles of the tongue are oriented towards the midline, medially. If this is weak because there's a problem with this side, okay, so this would be weak because the nerve that innervates this side is weak or absent. So this side would push the tongue towards the side where the abnormality is. Okay, so the tongue points towards the abnormal side. This is opposite with cranial nerve number 10. Okay, in cranial nerve number 10, since it has it innervates the, when we say okay, the soft palate, which is the upper posterior part of your oral cavity, okay, are raises, okay? It raises when we say ah. So if we're checking the mouth, no, we want to check for the tonsils or the posterior part of your oral cavity, we ask the patient to say ah. Because what happens when we say ah, the soft palate rises, okay? Uh, uh, okay. So there's like a finger-like projection at the midline of the soft palate. For example, here, this one. If this is my soft palate, at the one at the center would be your uvula. We call that your uvula, okay? So normally when we ask the patient to say ah, the soft palate rises and the uvula is at the center, okay? At the midline. So let's say, for example, this side again has a problem, okay? So this side, the nerve at this side has a problem. So this side won't rise, okay? Won't go up. So this side would go up. So what happens to the uvula? The uvula points towards this side, okay? So the uvula points towards the normal side, okay? So this one has a problem. This one, no problem. It would raise or it would rise, okay? So the uvula points towards the normal side. Uvula and tongue should be at the midline. Uvula, if it points towards one side, it points towards the normal side. Your tongue, however, points towards the abnormal side or where the side where the lesion is located. So again, we have 12 pairs of cranial nerves, and then memorize them and use your mnemonic, and then be able to also identify whether if the cranial nerve is a sensory, a motor nerve, or having both functions of sensory and motor functions. Hope you learned something out of this lecture. Thank you and thank you. Thank you and thank you very much uh, for your kind attention. Bye-bye.